Next, we have the Ask the Experts panel. My name is Anthony Martinez. I'm the chair of HD Reach's board of directors. I'll be moderating the panel today. We've got 4 wonderful experts who are here to answer any and all questions that you might have. We'll obviously prioritize questions from the audience. There are also some questions that were submitted ahead of time and some questions coming in through the Facebook live stream. So we'll sort of bounce back and forth across the dimensions. But before we begin, I'm going to let each of our experts introduce themselves. So let's start with Dr. Myriam.
I'm Dr. Myriam Sollman. I'm a clinical neuropsychologist located at a Huntington's Disease Center of Excellence in Columbia, South Carolina at the School of Medicine at USC. And for those of you who don't know, a neuropsychologist is an individual who specializes in understanding changes to thinking skills, emotions, behavior, and to some extent movement as well. We don't prescribe medications. We are specialists in using behavioral techniques, but it's very common for individuals to go see a neuropsychologist to assess where you are with those different skill sets so that we can make recommendations to you and your family for how to be your best. Things to avoid, things to do, things for your loved ones to help you with or to do for you, ways to encourage you, all those sorts of things. Thank you.
Thank you, Dr. Myriam.
Burton Scott, Duke University.
Hi, everyone. I'm Dr. Bonnie Hennig-Trestman. I'm the director of the Carilion Clinic Huntington's Disease Program in Roanoke, Virginia. I'm also the special programs director at HD Reach. I have written a book called Talking to Children About Huntington's Disease that is now in its 2nd edition. I lecture nationally and internationally about topics related to Huntington's disease. I'm a clinician as well as a researcher.
Good morning, everyone. My name is Lisa Hale, and I'm a clinical social worker from Vanderbilt. And the back of the room is telling me my mic doesn't work. So
Nope, just a little closer.
I'm a clinical social worker at Vanderbilt and the director of community outreach. And I am also a supporter and part of the support team for HD Reach. I'm excited to be part of your journey. I'm humbled to be here. And by the way, you all look so much better in real life than virtual. It is so nice to see you all. Good morning.
I'm Benjamin Gilmer, and I am still a student of this, but I'm trying to learn how to be a better provider in the community to bridge some of the gaps in Asheville for people who need help with Huntington's.
Excellent. Wonderful. So with that, I'd like to open it up to the floor to see if there are any questions for our experts. And I can get us started since it seems like you guys are a little quiet right now. So let's start with a big one. How close are we to having a treatment that slows or stops progression?
Dr. Burt Path.
As you all know, the way that progress is made in developing new treatments for Huntington's disease or any other brain illness is through clinical trials and through basic science that feeds into clinical trials, which is where you're testing new interventions in people or in patients. We've been involved with several clinical trials. The Vanderbilt folks have been involved in even more. Many innovative studies trying to turn down the abnormal gene that's producing the Huntington protein. There have been fits and starts in those clinical trials. I would say the trials that are involving using what's called an ASO to try to turn off the gene, the bad gene, have not been successful so far, but they're being retooled to try in specific groups of people. But still, that hasn't yet shown great benefit to this point. I would say the trial that we and probably the Vandy folks are involved with that we're hopeful about, but we don't know the results from, is the Perlinia trial of predopidine, where that's a drug that in a previous trial seemed in a smaller group of people seem to steady things, seem to not be associated with an expected decline over a time of 1 year. It's that particular drug, the predopamine, is being tested in a bigger group of folks. I'm not privy to the results of that, but it's my understanding that the results will be out. We'll get some sort of information about that by the late summer, I would think. But there's certainly some promise that, promise isn't a cure, but there is some promise that if that drug did what it did in the earlier studies, it might produce some useful steadying in Huntington's. I'd say that's the closest thing that's soon to have some information about. There's also a major emphasis in trying to take a pill that also manipulates the bad Huntington, and so. But those studies are very early phases of examination, and it's not something that's going to be happening soon. But certainly there is promise and hope that if those work out, then that would be a pill medicine to help steady things in Huntington's disease. Probably the closest thing is the predopamine at this moment.
And I'd just like to add to that from the holistic perspective. At the same time, through study of many movement disorders and neurodegenerative dementia-type conditions, we are learning things that we can do to protect our brain, to slow the onset and the progression, and that means avoiding cigarettes, avoiding alcohol, avoiding marijuana, trying to prevent head injuries. Exercise is really powerful for the brain, especially cardio exercise where you get your heart rate up. We've learned that your body produces a growth hormone that helps your brain to form new branches, so to speak, that can counteract some of the atrophy or shrinkage that's happening by virtue of these diseases. So we're learning lots of things that can be done, and of course also treating depression and anxiety and other psychiatric symptoms helps slow the progression of many of these neurodegenerative diseases. So you have to look at the big picture. Don't just say, when is there going to be a cure? When can we stop this? But think of the control that you have now, the things that you can do now to delay your onset and slow your progression.
So it sounds like the take-home message is have communication with your healthcare team. Try, if you are a caregiver, if your loved one with Huntington's disease is not doing some of those things that Dr. Myriam was talking about, try not to nag them, because then you're going to get burnt out as well, and there's going to be a lot of resentment. But talk to your healthcare team, have an open mind, and look for those things. Connect. I think it's really important to be able to have that ongoing communication with your healthcare partners.
I'm also going to take this time to do a huge plug for research in general, y'all. It is your opportunity to control your destiny. I'm going to classify research into 3 main categories. One being longitudinal or observational research, and I'm going to do a huge plug for Enroll HD. It allows you and your family members to go be part of an HD Center of Excellence or clinic that provides that opportunity. I'm equal opportunity. Go to the clinic that is closest to you. Get to know your team. Get to know your neurologist and the people that will support you there. And you're building long-term relationships, right? And then there are drug trials that Dr. Burton Scott talked about that are coming and they're in the pipeline. We want them yesterday, but being part of your center and understanding where your center is and being part of Enroll helps you be on that list and helps you be proactive and kind of own your destiny. We do want gene-modifying trials, and we want them to work. There's one right now, Unicure. It's very hard to meet that inclusion criteria, but most importantly, please, please, please don't be afraid of research. Any of the centers of excellence, any of the independent clinics, any of local neurologists can point you to where those trials are, and we look forward to supporting you.
Excellent, thank you. And I'll just wrap up this topic with a phrase that I try to live by. And it may seem like mom and apple pie, but a sound soul resides in a sound mind, resides in a sound body. And the idea here is relatively simple. The small things that you do to take care of yourselves and your physical state will definitely help slow progression as expected. So, all right. Any other questions from the audience? Yes.
So a few days ago, I saw an article that said Asia Technology, is it AI? I saw an article a few days ago that said Asia Technology is partnering with UBC Biopharma to use AI technology to identify targets and therapies in Huntington's disease. Where do you think AI in general can go as far as helping us find identifying biomarkers or potential new therapies or medicines?
I imagine that one aspect that they're working on is facilitating communication for people that have difficulty due to speech difficulty, like dysarthria. So, for example, in ALS, they work on tailoring technology specifically to what that person is able to do to help them communicate better, whether it's through using eye movements to select words, those sorts of things. Other thoughts?
I can add a little bit of, so on the AI front, I think, I got this one. Oh, sorry. I think what's really powerful about AI and machine learning is that you can parse very, very large sets of data to find trends that you wouldn't otherwise be able to identify. So, when you think about trying to identify potential targets for drug development or other biomarkers, things like that, just think of your genetic structure as this huge set of constellations where there's huge variability, right? Every person has their own set of constellations that make up who they are. So finding patterns across that huge amount of data can be really challenging unless you bring to bear AI and machine learning. Years ago, Pfizer worked in partnership with 23andMe using self-identification of depression, and they looked at the 23andMe data, and what they were able to find were biomarkers that indicated that people had depression or would have depression just based on the 23andMe studies, even using self-reported data. And self-reported data usually sort of perks up my ears and says, maybe we shouldn't trust that, it's not that great, but the confidence interval was really, really attractive. So, machine learning AI will really help us to improve and identify these targets faster just by looking at the trends that we might see across all of the data that we can collect.
I'd just say that as far as large databases, like Anthony alluded to, I mean, that's one thing that this enroll project that Lisa Hale talked about is doing. It's a big database. I mean, there's 25,000 people in it now across the world, something like that, and data is gathered on a yearly basis from those folks, and that's a big data set. And so I'm definitely not, I guess, an artificial intelligence expert, but this is certainly the type of database that one would explore with AI to develop new insights.
Okay, excellent. Questions from the audience? Anybody in the back? Okay, so what is the point of testing anonymously?
From our perspective, and I speak from my home base of Vanderbilt, it allows the individual to control how information is disseminated. The biggest decision in my perception, and y'all in this room get to correct me, is that 3 o'clock in the morning agreement with yourself and your heart that you're ready to come and talk with us. So when you come, you're already vulnerable, right? This is huge. So having the ability to control that information, to have it in an anonymous record within a system, allows you to control how the information is being disseminated. Also, too, it allows you to get your ducks in a row relative to long-term care insurance, life insurance, all the things that are critical that you have in place before you come to test. And as you all know, HD doesn't give you a lot of independence, but having the ability to control how you want to talk about your story and to whom you want to share your story is a very powerful thing.
So just to kind of add on to some of the stuff that Lisa is saying, whether it's anonymous or not, people should be looking into their benefits before they're tested. Doesn't mean you have
Thank
to
you,
have, it doesn't mean you have to get those benefits, but an educated consumer is going to be the best for you. So no matter what. The second part, just to kind of elaborate more, is if you work for an employer. I work for Carilion Clinic in Roanoke, Virginia. If I have insurance, if I have health insurance through Carilion, then if I do something in my medical chart, if I go to a doctor, then basically Carilion, who's paid for my insurance, does have access to my chart. So that's what we mean in terms of anonymous. If you are doing something outside of your insurance, where only you have that ability to talk to your healthcare team and to open up a chart that's not going to go to your insurance company, that is where the anonymous testing can be very helpful. This does not mean, and this has come up many times when we're doing seminars at camps and at World Congress, which Seth, Marianne, and I were just at in Glasgow, Scotland last week, that just because it's anonymous doesn't mean you should go and then find out if you are gene positive and then go to get your benefits in place. That's not right, that's fraud. So if you are able to walk in and say, I'm looking for health insurance, long-term care insurance, life insurance, all the different benefits, and you do that before you're tested, before there's anything in your chart, there is nothing wrong or illegal about that. So hopefully that will just clarify a couple of things.
Thank you for the clarification. Yes, ma'am.
If you test anonymously, can you still do the clinical trials?
Absolutely. Absolutely. You, at any point in time, regardless of how you test, are able to be in any research trial. Also, too, just to if you meet those wonderful things called inclusion criteria. But the really kicker part is, if you decide that you don't want to be in research, or you are, and you decide for whatever reason you have to stop, that does not in any way, shape, or form affect your medical care. As healthcare providers, we're here to provide that whole spectrum of service: patient education, patient research, and patient care.
Even if you've tested negative, so when Dr. Scott was talking about Enroll HD, I see the question in the back. Enroll HD, now it's almost 30,000. Enroll HD was in Glasgow. Many of the people who work on the Enroll HD from Europe were in Glasgow talking to us about the observational study. Again, observational study, it's looking at asking you lots of questions where there might be, and there is, a blood test at the very beginning. If you are at risk and don't know your status, you can be in this. If you've tested positive and are now symptomatic, if you've tested negative and are a family control or somebody in a family who's tested negative, you can be in Enroll HD. So thank you for that question.
There is absolutely zero charge. Thank you for that wonderful clarifying question. Also, too, depending on the mileage, how far away you are from where you test, Enroll HD will reimburse you for your mileage. So there might be a really cool lunch in there somewhere.
If you are being charged for a research or observational study, go and talk to somebody, because that should never happen. Okay, so there's a question in the back.
It's more of a tip. If you're looking into long-term care, we looked into it before testing. Some of the plans ask about parents and others don't. So we picked the one that didn't ask about the parents, only asked about my wife. But it could be a situation if you answer it incorrectly about your parents and then expect to get claimed, it's going to get rejected. So just be very, very careful about the questions on the plan.
Let me add, too, there's an incredible, and Erica at HD Reach, I can't see her beautiful soul, but wherever she is, she can guide everyone in this room to a wonderful insurance broker who is licensed in this state. His name is Davin, and he has a website that's actually dedicated to HD patients. He's worked with Erica at HD Reach, he's worked with me in Nashville at Vandy, and he can help you decipher all that fine print at the bottom of all those forms when you're looking at long-term care insurance and life insurance and making those really big financial decisions.
The one last tip in terms of that, which is I'm going to piggyback on what you said. If you are somebody who is interested in testing and you go to see somebody, now is also the time to think about having your adult children insured as well. Because your answer on that question is no, I haven't been tested, and my mother or father hasn't been tested either. Now is the time to do that. Even if your children are not interested in being tested, try to think about getting them to look into long-term care insurance as well. That's the time to do that. It's never too early.
I guess the one thing that I would emphasize, and maybe it's been said, but if you did get tested through enroll, the observational study, you don't get the results from that. It's a computer knows it somewhere, but that's not a way for you to find out your own test results. So it's a way to get tested, but you won't know the results. To get actual tests that you know what your CAG repeat number is, you'd either go through an anonymous testing protocol or a clinical protocol, but not through enroll.
And you can stay in enroll. So if you start at risk and you decide to get tested, whether you're positive or negative, you can still stay in enroll. So thank you for that.
And what's super cool, we'd love to say that you're all going to stay in this beautiful world of North Carolina, but you might move, and your enroll can be transferred to any enroll site, which is super cool. So don't feel that you're limited just because you move. You're always part of it.
Question, as terms of testing anonymously, is there ever complications where if you do, say you are gene positive and in the future you want to participate in research or receive treatment or eventually do need it documented in some way, would you have to theoretically retest, or is there a way to release your anonymous results?
I speak for my center. Other centers may have other protocol, and I want to respect that. However, for us, you do not need to be retested. But that's a great question for any social worker in any center, any private clinic, et cetera. So just ask, but in my world, no, it does not make a difference.
Through our testing and HD Reach, what we do is at the end we give you your results. It's a pseudonym, which is basically a fake name, and then we give you a piece of paper that says this is who you are with your real information, and it connects you, so you can actually take that information. But depending on the research, they might initially for everybody want to test you just to make sure as well. So it is very individualized and just check, but when you are tested, even if it's anonymous, it sounds like most of the people up here will give you a piece of paper that says, here are your alleles. Alleles is just a fancy word for gene. It's just there are two genes, one from your mother, one from your biological father. So we give people that information, and because we use pseudonyms, we do connect them and give that person so that they can decide where they want that information to go.
And sorry to interrupt the panel. Just a quick I just locked Debbie's phone. If you have a black BMW with a license plate HHH and then a couple of numbers, it looks like it might be about to get towed. So just a quick heads up to anybody with a black BMW, 3 H's in the license plate. Yeah, it doesn't look like it's us. So wherever Debbie is, I have your phone, Debbie.
Let me just comment at Duke. To this point, we have not been doing anonymous testing, but if you get your anonymous testing done through HD Reach or someplace else, and you have some piece of paper from a certified lab that identifies your name with this lab result, that should be sufficient for participation in clinical trials that require a CAG repeat number. The worst case would be that the testing would be repeated, yes. But if you've got some lab value from a certified clinic that has your name on it, then that should be sufficient for clinical trials that we do.
Yes, right here.
I recently read a book on the mind diet. Do you have any feedback on whether or not that has efficacy in kind of stabilizing or slowing the progression of HD?
So I talk about diet a lot with my patients, and the data are mixed with regard to how diet affects you, but what I can say is that we know that spiking your blood sugar is bad for the brain. It causes the blood vessels to become more fragile. You're more likely to have small bleeds or microvascular lesions, strokes really. Diabetes has terrible effects on the brain. High cholesterol has terrible effects on the brain, and everything that we can do to slow our brain aging helps slow progression of Huntington's disease clinical symptoms. So diets like the MIND diet force you to think about what you're putting into your body. They also tend to have fewer foods that promote inflammation throughout the body, like gluten is one of them, even for people that are not gluten sensitive. When we eat, and especially if we eat too much, there are inflammatory responses that neuroscience is saying affects our brain and our brain's health. And so again, everything that we can do for our body is going to help our brain as well. There is some promising data on the MIND diet and the Mediterranean diet in Alzheimer's disease. And so, I say, why wait? If it might help, give it a try.
Yeah, I agree. I generally recommend Mediterranean diet. MIND diet is certainly a diet that emphasizes fruits and vegetables. Still eat meat, but not emphasizing that. Maybe there's a little fat in there, but it's not emphasizing that. More nuts and fruits and vegetables are certainly a good idea.
Dr. Scott and the rest of the panel, do you have any recommendations around supplements, fish oil, phosphatidylserine, vitamin B, anything? Mm-hmm.
So as far as supplements, I personally don't recommend supplements until I've seen data that's proven benefit. And so I generally just recommend a good, well-balanced diet, take a multiple vitamin, but I haven't recommended any particular supplements to folks.
So a question, if someone is, say they are untested at risk, or maybe they've tested anonymously, and either way they're exhibiting some early symptoms of HD, are they allowed / able to still come into a clinic, for example, like Duke, a center of excellence, and be treated to manage those symptoms without having a genetic test?
Absolutely, yeah. So any patient can come to our clinic or anybody else's clinic. You're a patient, you're a patient. If you've got a medical problem, you can come to a clinic. So we don't have to know for sure that somebody has Huntington's disease to treat somebody for that problem. If you've got a family history, that's helpful. A family history of Huntington's disease, and you're showing clinical signs of Huntington's disease, then that's a diagnosis there. But the answer is, absolutely. Whether somebody's been tested or not, they can come to a Huntington's clinic or other medical clinic.
And I can give you an example of a woman that I worked with for many years who has a strong family history. She was young. She had depression. She was really concerned about, what's it going to feel like if I do test, and if I find out that I'm positive, how am I going to cope with this? So we did exactly what Dr. Scott had said. We were treating her for depression. And after a year, she felt much better, and she said, I think I'm ready now. I have my resources set up in terms of my support system. I have you guys. I'm ready to be tested. She was negative. Right? So we know that growing up in a family that has Huntington's still can be traumatic. It still can lead to anxiety and depression. So exactly for the same reason that Dr. Scott said. So if you want to come into a clinic, we are not going to turn you away.
And I was going to add, wanting to avoid knowing if you have HD is respectable. That is your prerogative. That's how you can have control over your situation. But if that's what's preventing you from getting treatment for any specific symptoms, just communicate that to your doctors. You get to form that relationship, and you can go in and say, I come from this family. I don't want to know. Don't tell me. Don't give me my notes. But let's treat my symptoms. And that will help you feel in control of your situation, and that will help slow progression, give you better quality of life.
And also, too, one thing to remember, this is a long-term relationship, right? So when you want to check us out because you want the best possible relationship. So whether it has HDSA in front of it, or if it's a private clinic, or if it's a private neurologist, We want you to come and check us out. Call us, say, we have the responsibility as centers of excellence to do community outreach for you and to you. So that doesn't mean that you have to have anything more than a question. Come talk with us. Come check us out. I, like Bonnie, had one person actually who was homeless and would come with her dog, and we'd sit outside my clinic at Dunkin' Donuts, and for 6 months, she wanted to make sure she was going to be regarded as a human being, not someone with HD. And that, guys, is the essence of why we are all sitting up here this morning. So absolutely, put us to work. And we all are up here, but we all talk to each other all the time. And again, the relationship is the most important. So if you're like, this might not be my fit, that's perfectly okay. Tell us, and we'll refer you to what we think is your fit.
Just to put a plug in for your primary care doctor, sometimes we have to be educated on where centers of excellence are, but we love to listen to you. And so while you're processing this very difficult decision, don't forget that your PCP can be an integral part of that team. Starting, psychiatric therapy early is something that we do really well too. So during this confusing time before you get to one of these centers of excellence, keep that relationship flowing.
And do remember that a center of excellence, you don't have to be a center of excellence to give excellent care. We are not a center of excellence in Roanoke. So just to know that primary care physicians, somebody who has expertise in Huntington's disease or even cares about this population is okay.
And maybe as an extension of this topic, could you speak to establishing a baseline and then measuring progression of the disease over time? How do we know where we stand, whether or not we're moving in the right direction, et cetera, et cetera?
Yeah, there was a great question that was sent to us by email about that. And there are many different ways to measure where you are in your disease. Of course, we can look at the number of CAG repeats and how old your family members were when they had symptoms, those sorts of things. They can do an MRI to take a picture of the brain and see how much atrophy or shrinkage there is. But as a neuropsychologist, I'm biased, and I'm going to say the best way to know how you're doing is how you're doing clinically in terms of your thinking skills, your behavior, your responses to things, your movement to the extent that we test that. So a neuropsychological evaluation from a good board-certified neuropsychologist will look at the whole picture. They'll seek input from your family members as to what the family members are noticing, because tests don't always measure everything that we see in day-to-day life. And then the neuropsychologist can tell you what your strengths are and how you can use those to do better, what your weaknesses are, and ways that you can work around them. And that's a great baseline from which to monitor you over time. And you don't necessarily have to go back and do another evaluation to see where you are in the future, but if it's a good neuropsychologist, you can usually go in and say, this is what I'm noticing in my everyday life or in my loved one's life. And then they can take that information that they have from the baseline and make suggestions for you. When it comes to deciding if it's time to retire from work or seek disability, that's such a complicated question that involves so many different factors that cognitive testing alone won't handle that. You need that personal discussion. You need to think about what the risks are involved with going to work and potentially making a mistake, so on and so forth. So really having that relationship with someone, building it, and continuing to work with them is what's going to be very helpful for you, in my opinion.
And what I heard Dr. Myriam say, which I think is really important as a take-home message, is have that open communication with your loved one. I know that so many family members say, I don't want to upset him or her by saying, I don't think you can drive anymore, or I don't want to point things out. But if you establish this early on, that we're going to have open communication, and if there's a problem, I'm going to call the HD Center, not as a punishment, not as to get you into trouble, but because they might be able to do something to give us tips, or perhaps medication, or a combination of both. So I really encourage you. I know how difficult it can be. I've worked with people, as people on this panel have for many, many years, and I know that it's very difficult for family members to say, this is what's going on, or I'm going to speak up at one of my clinic visits because my loved one is not telling, the whole picture, or he or she is a bear to live with. It can be unbearable anyway. So if you have that open communication and say, this is not to get you into trouble, but to see if we can do something about it, that's really, really important.
And as an extension of that, go ahead, Lisa.
Just one final thing. You can use enroll initially as a research visit to come in each year if you're not experiencing symptoms, and it's a nice way to come into the clinic, meet with a neurologist, do your cognitive testing, and to what Dr. Myriam said, once you're starting to, and Bonnie, when you start to see those symptoms, that's when you pick up the phone, and it can be the clinic coordinator, it can be the social worker. That's what we're there for. Give us a call and say, I think things are starting to change. And we'll bring you in, and we'll work with you, and we're comfortable with those changes. That's okay. That's what we're here to help you with.
And just to emphasize, the goal of talking about these changes is to protect you from any harm that could come about it, to make sure you have all of the resources and support and love that you need, and to make sure that your physicians know what medication or medical needs you might have to best help you. Knowledge is power, and that's what gives you control.
And do you have any recommendations for folks, care partners that might be struggling to convince their loved one that maybe they do have symptoms or that they need care, or maybe they've already convinced them or they already know, but they are refusing to get the care that they need?
I think this is, again, that open communication with people to say, I know this is difficult to talk about, I know this is difficult to hear, but we can't live like this. We can't live with, walking on eggshells every single day. We really need to try to get you in to at least see somebody because everybody feels this way, kind of like a little intervention. Sometimes you have to wait till things get really bad. As I say to people whose loved ones do not want to go in at all, that first fall, don't just pick the person up, dust them off, and say you're going to be okay. That might be the gate to be able to say, I'm going to bring you to the emergency room because we're not sure. There's lots of ways to do this. Even if you are somebody who is a caregiver, pick up the phone and contact your local facility. Talk to people in the clinic to say, how do I do this? Or just that you yourself need support. Joining a support group for you as a caregiver could be a good place because other people can share how they did this as well. It's quite common, and if we had more time, especially Dr. Myriam would go into anosognosia, that lack of knowing that the person with Huntington's disease might have. So there's lots of different ways you can do this, so please do reach out.
And when you reach out, you can create a strategy with your clinic coordinator or your social worker. There are things your loved one loves to do. It may be sports, it may be church, it may be a hobby. We can work with you to strategize to get past whatever that obstacle or trigger is. And it can be just as easy as coming in and sitting down and just having a conversation. Because really what we're trying to do is start that communication, as everyone said, and start that rapport. We can be really creative, so let us help you.
The other carrot we have used is getting people, as Dr. Myriam had said, on disability. So sometimes being able to say, it's very difficult to get up and get to work, or you're looking for a job and it's very difficult. If we go into the center, we might be able to get some testing and see if it's time for you to start a disability process. So that's sometimes the carrot, to be able to say, you deserve to have an income. That might be a way. Go ahead.
And it's certainly...
Go ahead, Burt, please.
All right. No, I was just going to say, as far as for the hesitant patient, somehow developing a rapport, whether it's, as Lisa and Bonnie are saying, going outside the clinic to meet with somebody, that's an interesting option. In addition, clearly you have to develop some kind of rapport, some kind of trust with the patient that's suspicious. I do think there is a utility in some situations, perhaps like this, to do a video visit. So where patient doesn't have to come into the clinic, they don't have to go to the big clinic, but they can stay in the comfort of their home with their loved one next to them. So a video visit is an option to start the process and develop some trust and rapport.
We might not be able to treat at that time, and at least what I can say in Virginia is if we are meeting with somebody on video, which we do, it is about rapport and then asking them to come in, because sometimes doctors are not always allowed to prescribe medication if the person hasn't come in at least that one time. That might be changing. That might be changing with COVID and some of the insurance companies, but I don't know if it's the same in North Carolina. It's the same? Okay, so just know that that's a little bit of a caveat. It's not that you're going to log on and all of a sudden somebody's going to prescribe all these meds and your loved one's going to be great. But what we do is at least have that rapport so they see we're not scary and we're not going to be asking them a whole bunch of questions that they don't want to hear, at least in that first visit.
So I just wanted to build a little bit on what's already been said, and that is that, first, it's hard getting access to care. It's really critical that if you have a primary care physician and they don't know much about Huntington's, to feel free to help to educate them, to support you, because they're the folks who you are going to see most frequently and most often. Integrating the care that you need across your lifespan is super important, because you're not only dealing with Huntington's, you're dealing with many other conditions as life progresses. The other thing is that neurologists ain't the only specialty that work with people with Huntington's. The primary presenting symptoms are, as we've heard, impulsivity, depression, anxiety, so many other cognitive impairments. So psychiatrists in general, neuropsychiatrists in particular, also across the world can be the primary caregivers for people with HD. So it's important to recognize the broad opportunities that you as a family with HD have for seeking care.
Just want to say who that was. So for any of you who don't know, that's Dr. Robert Trestman. I happen to wake up with him every morning.
And I was just about to thank you for your beautifully insightful comments. But I was going to add, not just for the patients, but for care partners, getting help for the psychological aspect, the coping mechanisms, anxiety, depression, frustration, stress. It can be really challenging to find mental health services these days. But I think maybe one of the only good things that came out of the pandemic is that now we can seek mental health treatment through telehealth. So you can reach out to companies like betterhelp.org or Calm, I can't remember, there's tons of them. And you as a care partner or a family member or as an individual with symptoms of anxiety, depression, or psychosis or anything, you can get help for that. And that is going to help you and the people around you.
Just one comment on the co-management of complicated illness is so important. And a lot of my patients who live in rural places, they don't want to go to the city. And so we will oftentimes Zoom in a specialist, have a conversation together, and that's really gratifying for me, for the patient, for the family, that we enable to negotiate that with easily, and it's something we do all the time. So ask your primary care provider, can you help co-manage this?
Just a heads up, that nice little hum is the AC kicking on, so don't worry, guys.
What questions can I ask I'm going to do this in a different way. I was trying to make it so vague, and I'm just going to ask it direct. I have a family member who is HD positive, has had symptoms for years and years and years, is pretty advanced. He has a neurologist who doesn't seem to be very interested in treating any of these symptoms or anything. What questions can we ask our providers to see if they are interested in supporting these diagnoses, or if we need to move on?
My comment would be it's part of our jobs as HD clinics and or HDSA centers of excellence to collaborate. So wherever your closest center of excellence that you know and adore, call them up and say, hey, can you do some community outreach for me? This is my person. My person already has someone that they trust, that they have that initial rapport with. Can we have like a phone call, so a joint phone call around the three of us, and we've done it, I've done it, just so that person in a safe space, that provider, can ask all those questions, because Dr. Gilmer said it beautifully. In HD for neurologists, and I've learned this after 6 years, I'm only 6 years old in HD, I'm 59, but I'm still learning and growing every day, right? HD in a medical book is a paragraph. And there's wonderful subspecialty individuals that know the whole book, but not every neurologist or primary care person knows that book. So we as HD clinics are here to provide that community education, and we'll be glad to work with you to do that.
One of the other things, let me just jump on that and then I'll have you go, is a lot of times, and I can give you the example of Carilion Clinic, we have something called My Chart through Epic where you're able to reach out. What I say to people is ask the provider, these are the symptoms that we're seeing. Is this something you are able to treat? My understanding when I've done the research or when I've reached out to centers is that these are symptoms of Huntington's disease. Is that something you can treat? If not, should we go someplace else? Can you recommend somebody? So that might be an immediate thing that you can go home today and say, let me log on, let me ask the question, and hopefully you can get an answer, in addition to what Lisa was saying.
So to expand on that, finding psychiatrists or people who actually have knowledge of how to treat a complicated disease like Huntington's, even though they're just there to treat the depression or whatever, is there a elevator pitch, or is there a guide or a resource, and maybe through HDSA, that you can pass on? I mean, trying to get the information for me, it's not going to be as accurate as I would want my provider to know. So is there the information I can say, here's the resource, take this?
I'm going to put a wonderful human being on the spot that can answer specifically. But I can tell you, as that microphone goes back to her, yes, there is information from HDSA that can help you to get your person or your people or your family on board. And
Hi,
she's
everybody.
given me eyes. Her name is Marianne Emmerich from HDSA.
Hi, everybody. My name is Marian Emmerich. So I get these calls every day about informing primary care physicians and people that just don't understand HD. Like Lisa said, there's a paragraph you get 1 day to learn about Huntington's disease in medical school. And myself, HDSA, HD clinics, anybody here is all these websites. There's plenty of materials to share with them. And remember, as everyone says, you guys are the expert on your loved one and this disease. Maybe not your provider, so empower yourself to advocate for that. But there are plenty of resources to share with them and people to connect them with to share that education.
And also, too, I'm going to do another plug for HD Reach. This is their whole essence for being is to take your challenge. They already know the resources. And go put those boots on the ground. They're going to hate me because I say this all the time. But get those boots on the ground and get out there and get what you need. And I'm going to put a shameless plug for the two of them. They're in the back of the room. Brandy Dellenbeck and Erica Bulowski. They are your people. And they can get you where you need to go. And they're going to get back at me because we all are on speed dial. But we all work as a team. If we don't have the answer here, we'll go find it.
We also have through HD Reach something called Therapy Path. So although we do not accept insurance through HD Reach because we're not part of a medical clinic, we do have one clinician who's talking who provides therapy online. So sometimes at least being able to start with me and saying, I'm going to sign up for 2 or 3 sessions. Then having maybe a release of information through a primary care or through an HD center where I can speak to that person and say, here are the things that are going on. We actually do that with Dr. Scott with a shared patient. So when I see him, I have some concerns, I send that over. He's able to say, okay, here's the stuff that's going on without having to go through all of that. So there are lots of ways, even just through HD Reach, to be able to do this.
I would love to plug as a caregiver. It's a lot, and you are the best advocate for your family. You know who these people are, the symptoms they're experiencing, the changes that they're going through, and you are their best advocate. But there is support and resources out there. So even with HD Reach, Erica is the community outreach specialist, and if you call her up and you say, this clinic has no idea what they're doing, they can host an in-service. They can contact the clinic. They can provide education, provide resources, so you have people to support your advocacy efforts.
Also, if you are part of a family, an HDYO, Huntington's Disease Youth Organization, again, where Seth and Marianne and I were just at the first World Congress in Glasgow, Scotland last week, we do support young people aged from 0, but at this conference it was 18 to 35. So we support young people globally who are impacted by Huntington's disease. That doesn't mean that they have to be positive or have juvenile onset or even be at risk. They could just be a young person who interacts with somebody who has Huntington's disease. Please, please, please talk to your young people. We have all kinds of resources on hdyo.org. We have webinars, we have in-services, all kinds of different things. Please do talk to your young people and know that there are services out there for them.
And also, too, if anything, you're not alone. I know things get bleak at times. You're on a roller coaster, and it's not the really fun one that's at any Disney space. Don't be afraid to reach out. We're here. We have different titles after HD, but it really doesn't matter. We're all a team. We work collaboratively, and we are really here to get you where you need to go.
I was just going to say something to that. There is no other disease with this many advocates. Like Parkinson's, it doesn't happen. Frontotemporal dementia doesn't happen. The Huntington's community, I've learned just by seeing you all at work, is amazing in terms of the community efforts and collaborative support.
And just to circle back around to your question, I mean, it is your right to communicate with the very busy PCP, if it's a very busy person, I'm sure, but to let them know that you're concerned about this, that, and the other thing, and your loved one, and you're concerned this may be Huntington's disease and may need additional treatment from what they're getting. Would they like to speak with somebody who knows about Huntington's disease? And their answer may tell you what you want to do with the PCP. If doctors should be open to patients. They're really busy. Everybody's really busy. All the clinicians, all the providers, everybody's busy. But the provider should be open to educating because, as other people have said, no one person knows everything. It takes a lot of people to take care of Huntington's disease, and it takes more than just the expertise of one individual to take care of Huntington's disease. The PCP should be open to some kind of, or one would hope that the PCP would be open to some kind of help if they want it. And that can come from, contacting somebody who knows about Huntington's disease and saying, this person would like to talk to you, and go from there.
I just want to add to that, don't expect your PCP or anybody that's not necessarily like HD specific to do the research on their own. Bring it to them, ask them the question, say, do you want me to connect you with somebody? I know my loved one feels really comfortable with you, but there's so much more that you need to know. And I have a question for the panel. One, thank you all for everything you do, and thank you for everybody in this room. But what would you suggest a clinic or a primary or even an HD specific clinic that doesn't necessarily reach out to the caregiver or the loved ones to ask specific questions?
I'm going to jump in first. This is my passion. HD is a family disease. You are all here because it impacts you in some way, shape, or form. You know your person. You're teaching us. You're teaching us what I affectionately call the good, the bad, and the ugly. And it's our job to be your wing people, to be there 24/7 to give you the tools that you need to succeed. And that's what we focus on. And I can't emphasize it enough. HD Reach can help you in that as well. You have a special care, you have a special need, you have a special energy that we need to keep alive. And that's what we're all here as providers to do, each and every one of us, regardless of the name of the clinic. And we thank you.
And I want to add also, you know, for care partners and people who identify as caregivers, it can be a very challenging job. You're juggling many, many things, and there aren't always the resources you need to guide you, the education you need. Start with the internet, the HDSA website. Think outside the box. There are websites for Parkinson's disease and for Alzheimer's disease states that have so much money funneled to them that there are numerous resources that will be really helpful for you. How to find attorneys that specialize in writing documentation that you need. How to find a caregiver support group. So maybe your experience isn't exactly the same as someone who's caring for someone with Parkinson's disease, but there are a lot of similarities. And so those care groups can be very, very educational and supportive and helpful for you. So just think outside the box.
Hi, don't worry, I'm not going to grill you, Bonnie, I promise. So putting on my HD advocate hat, one thing I will say regarding searching is that Google can be very good, but also not so good from personal experience. So I agree with searching. I would just emphasize, like, remember once you search, you can't go backwards, whether it's Google or the Facebook groups. And so just understand that it is important to get that support, but just knowing that HCSA, HD Reach, HEO, there's a lot of organizations out there. So just kind of, again, personal experience, Googling it, I was like, this is great, learning about HD, but I was like, wow, this is also a lot to take in when this is new. So that's just, again, I totally agree with you, and it's not to say anything, but when you mentioned search, I think it was just kind of a, oh, wow, I did that. And I totally was like, no, I knew that's not exactly what you meant. So that's why I was like, okay, but I get the search part of like the support and whatnot. So but the other kind of question I just wanted to ask is from an access standpoint, Dr. Bob kind of mentioned it, is affordability. So you mentioned all these amazing neuropsych exam, MRIs, seeing doctors, but from an affordability standpoint, whether they have insurance or not, how does that work to see an HD specialist?
My recommendation to you all is talk with your social worker at the center that you are working with. Ask, don't be afraid, be honest, come to the table and say, hey, this is not something that was in my financial plan. What resources do you have? What indigent funds do you have? What hospital or clinical financial plans can I get into? For your prescriptions, many pharma companies support and have grants. Have your specialty pharmacy work with you to find those grant options so you're not paying full price for medications, right? Also look to resources within that social worker, not just for the clinic visit, but for other financial supports as well. Don't be shy, guys. There's stuff out there. We'll help you.
And in my experience, the larger academic medical centers have more resources, and they do have a lot of indigent funds. They use it as a tax write-off. So they're eager to help you get medical services that you can't afford. Okay.
Also, too, research can be an ancillary support. Research provides, enroll provides that wonderful mileage that gets you to the center. You get to see a neurologist while you're there. If you're in a type of pharmaceutical trial, clinical study, there's reimbursement there. Your clinic will get super creative with you and will get you a clinic visit on the same day. If you have to see PT, speech, or OT, we'll get you in. So it's one stop versus 5 different visits.
And do you have any recommendations for somebody who maybe can't find long-term care or knows their gene status before putting into place long-term insurance? What are the options for people facing that situation?
I think talking to an elder care attorney can be really helpful. You know, when you think about Huntington's disease as a young person's illness, a lot of times it can start in their 30s. However, if you're in that situation, or even before, if you are at risk and you want to talk to somebody, I think really making sure that this is not just talking to your neighbor or somebody who says you should do this. Really going through and talking to, especially an elder care attorney who might say, well, if we can't get you on long-term care insurance, can we start a fund? Is there something you can do? Can we start to get the house in somebody else's name? Can we do these things before they're needed? So I think even HDSA has an incredible disability specialist. You know, you call HDSA and you talk to Allison, she will walk you through a lot of these things. So I think that there are options, and just because a neighbor or somebody else in the HD community says you should do it this way or I did it this way, that's one opinion, and I think it's really important to be able to get a lot of professionals' opinions.
HD Reach has resources as well. Erica and Brandy can get you to those resources that can start those questions, and you can never start early enough. So we don't care where you go, HDSA, HD Reach, but Bonnie's perfectly right. Research, 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 get your information, get it locked down, and we'll work with you to sort it out and get you where you need to go.
I will say applying for Social Security disability is a word I want to say. It sucks and it's hard. And Allison Bartlett, HDSA, is absolutely phenomenal. She may throw a lot of information at you at first. It's a lot to digest, but she is the only reason that my brother's application got approved the very first time. So I highly recommend her if you are struggling with the Social Security disability process.
So people are talking about SSDI. So what Melissa is talking about is Social Security disability. If you work for an employer and you've worked and you've put money into Social Security, it is very important that the person continues to work until they start to think about applying for disability. We have had people who have stopped working, either they were fired or they quit or they couldn't do the job, and then decided many, many years later that they were going to apply for disability. Please know that when you put in money to disability through an employer, it is cumulative. You have these rolling credit hours. The minute you stop working, all of a sudden those credit hours start falling away. So it is really important, again, that might be some of the ways that we get people into a clinic to say, you need to do this now, so that somebody can walk you through. I do this a lot with our patients at Carilion and when I was in Connecticut, that I really work to say, let's get the neuropsych evaluation, let's get some of the paperwork from the physician, let's get everything and create a story. Let me get a letter from the family. Let me help them to fill out this application. So people will say to me, Social Security is always going to be denied the first time. I have been doing my work for 25 years. I have never had a denial because at the very beginning, I was able to work with an entire team to say we need to create this picture for a person who might never know what Huntington's disease is, who is reviewing that application. So it is possible to be able to do that.
And if you do have a neuropsych exam, let the neuropsychologist know that you want to know if it's time for disability so that we know to document specifically if you want to seek disability, that it's time. That is a strong statement that helps you to get that insurance and those payments.
I cannot emphasize even more. Dr. Kieran Considine is our neurosoul at Vanderbilt. The neurocog assessment is critical. It's like the bow on top of the present that gets that application approved. So if you need resources or you need some help in getting to that person, just let your center know, let your PCP know. Get a hold of us. We will help you.
And I agree with all that, and that we at our clinic rely on these issues for payment of services or for disability or navigating the system kind of thing. We rely on our social workers and we rely on the neuropsychological testing as far as the disability goes. So again, it takes a big group of people to do these things, or it can take a big group of people, not necessarily all in one place. But we rely on the expertise of our social workers and our neuropsychologists.
I will add, and we'll probably say we'll be wrapping up pretty soon to take questions. We're getting ready to serve lunch, which is the good part of the day, the best part of the day. But we've had an amazing panel. One question I'd like to throw at you is say, a situational thing. So a lot of people, we've talked a lot about the psychiatric symptoms, and you hear a lot about anxiety and depression and forgetfulness. And if I'm like feeling really anxious and I've been kind of depressed lately and I'm constantly losing the keys to my car, does that mean I have Huntington's?
No. It could just be normal chaos of life with family, friends, kids, dogs. My dog ate my sock this morning, so I'm really kind of worried to go back home. But that's my anxiety at the moment. But no, it does not. But that's also a really valid question. Call and talk to your social worker. I mean, chaos is chaos, and it kind of adds up. So if you need some help, as I call it, peeling the onion, figuring out what's going on, that's what we're here for.
When you are diagnosed with having the gene, unless you have seen a physician who has expertise to tell you that you have symptoms, you do not have Huntington's disease. You have been told that you have a gene that you've had since you were conceived. So it is really important to separate those out, to say, if I've tested positive, that means I have the gene. If I've seen somebody who has clinically seen me and has said there are some symptoms here, that's different in terms of having the Huntington's disease. But as I said with that story before, just because someone has anxiety, depression, irritability, and all those other things does not mean that you have Huntington's disease. People who are at risk and people who are positive gene or symptom seek. They look sometimes for those symptoms. We can't help it. Parents of children will look and say, is that what's going on with my loved one, with my child, my adult child, or my child? So that it is really important to openly have communication with a healthcare provider in terms of, is this a symptom of Huntington's disease?
Yep, and I'll just echo something I had said earlier about the complexity of our genetic profile, right? We are a unique set of constellations that all form together to create our experiences. So while you may have the similar number of CAG repeats to somebody else that you might know, some of the other genes that are expressed in your body could be completely different. Drugs could be processed differently in your body and in your bloodstream, and there are lots of different things that will play into that, so you'll each have your own unique experiences. And I think this is actually a great plug for a session we have later today called Symptom Hunting. It'll be at 2:15, where we'll discuss things like the anxiety related to twitching, stumbling, losing your keys, misspeaking, those types of topics as well. So we have about 10 more minutes. I have a couple more questions, but obviously, if anybody else has any questions, maybe some in the back. Right here.
It's so complicated. What would be a good gateway? The first thing to, because there'd be a lot of, for me personally, it's a whole family of people and issues in constellation. Like you're saying, I love that quote. I won't get your name, so I can quote you on that. It's really good about the constellation. Like if you could set up, if I could set up a, and I think maybe a lot of people might feel like this too. It's just so overwhelming, we don't even know where to begin. So if I could just talk with, if I could just set up or anybody, where would we set up a consultation or whatever, a gateway type thing? Is that a question?
Who would be the best person to kind of start with?
Yeah, or how would you start? Yeah. It's just like there'd be so many issues. I wouldn't even know where to begin or what to do, really. So I was hoping I could find online resources and check from that, but no, I don't think so. I think it would be overwhelming to even go on Google and try to figure out some of the
It's okay to be overwhelmed.
And some of the things would be so sensitive, you wouldn't want to discourage other people that've got Huntington's. So you'd want to talk with a professional rather than just in a whole group. For sensitive, very, very sensitive things for other people.
Thanks for asking a really difficult question. I want to celebrate you for that. It's tough. Like I say, at 3 o'clock in the morning, oh God, am I really going to call? Am I really going to call? You can call HD Reach. You can call Erica at HD Reach. You can call Brandy at HD Reach. And they can actively listen. There isn't a whole lot they haven't heard. And you can just kind of lay it out there and let them be your person. If also, too, you can go to hdsa.org. And you can go to the HD Centers of Excellence, and you scroll down to wherever. I'd like to say you live in this wonderful world of North Carolina, but you might not, and your person might not. So go to hdsa.org, go to the Centers of Excellence, double-click on that state that's closest, and call that person. And that can work as well. But if you're in North Carolina, HD Reach, Erica and Brandy, give them a call. They will compassionately and actively listen and help you sort through all those questions that are ruminating in your heart and in your mind.
Yeah, just think about when you find that box of tangled cords and you're like, does anyone enjoy untangling these? Which personally I do, so if you have tangled stuff, I love to. But in a professional sense, like that's who people like Erica do, and Brandy, and Myriam back here, and all of these wonderful people up here. They are your one-stop shop to kind of start untangling the threads and be like, okay, let's break it down. Let's see, like, where do we need to start? What's the most important thing we need to tackle first, and kind of break it down and go from there.
I have to say, our niche is kind of disentangling too. That's.
It is, and
In fact,
also
I think family medicine might be rivaling psychiatry and neurology.
Yes.
We're going to arm wrestle over Huntington.
Also, too, I'm just going to say we have questions, too. Sometimes the tangle gets really big, and I've been known to call this lady to my right and go, Dr. Bonnie. So it's okay.
And there's a dance. I call it the dance. You guys talked about tangle. I say it's the dance. So there are times that somebody will call me, and then I won't hear from them for a couple of months, or I'll try to reach out and they don't answer, which is fine. I just want to let you know I'm here. And then sometimes you'll call back with another question, and then maybe another question. And there have been sometimes people that I've had this dance with for years before they actually come in. There's nothing wrong with that. You need to do this on the time that is on your timeline. But a lot of times it is just saying there's somebody out there who I can connect with, and it makes you feel comfortable.
I would just like to say that the most common question I get on a national level is, I don't know where to start. So great question. And I sort of love being that first person to help start that untangle.
So I guess one thing we're saying is you can also talk to us. So people in this room can help you get started. There's national resources, there's HD Reach resources. HD Reach is here. We're also here.
Excellent. So I think we have time for maybe one more question and then some announcements.
Just a quick question. The $500 million Medicaid expansion in North Carolina, which hopefully will happen, does that somehow help somebody with HD that wasn't previously helped? In what ways? You may not have the answer to that, but that's a question I have.
That's a very good question. How the expansion of Medicaid and the additional $1 billion that Governor Cooper would like to devote towards enhancing resources, we don't know yet. But certainly, if you are, available for Medicaid, it will be your access.
I guess what I'd say about that is I think it's a godsend that we're expanding Medicaid, at least from the standpoint of taking care of Huntington's patients. I work at Duke. Duke wants to make money. Every clinic does. But somebody that's got Medicaid versus somebody that doesn't have any insurance at all, I mean, they can come to clinic and get their services paid for. There's hoops that you have to go through. But expensive medicines are covered. Stuff is covered by Medicaid. When people don't have any insurance at all, we still get them in through the enroll study. We get the study to pay for some things. But it's trickier, and paying for medicines is a lot trickier. Medicaid, at least to my mind, opens things up for folks that didn't have coverage before. And so many times the Huntington's families are relatively financially tapped out. Thank you. And so, anyway, you know, something that helps folks that haven't been helped before. That's, to me, that's what Medicaid can be, and I'm glad that we've got it.
It's going to increase access to federally qualified health centers across the state, which works, again, collaboratively. So they'll have increased access to in-house social workers, therapists, et cetera. So great network throughout the state.
Excellent. So please join me in thanking our expert panelists.